Hello guys, you're welcome back to my YouTube channel. My name is Peace Treze. I'm a nurse and midwife, and currently I practice in the NHS England as a registered nurse. So today we'll be talking all about ovarian cysts. So I'll be telling you what ovarian cyst is, the cause of ovarian cysts, the treatment, the symptoms, and at the end of the day, I'll be discussing two different types of ovarian cysts and finally telling you how you can get pregnant even if you have ovarian cysts. So if this is of interest, please keep watching till the end. Do not forget to share, like, and subscribe to my channel. If this sounds interesting to you, please keep watching till the end. So let's get started. Ovarian cyst is made up of two words, right? Ovarian and cysts. And ovarian comes from the word ovary. So when you talk about ovarian cyst, it simply means sacs that are filled with fluid that are also found in the ovary. This is the simplest way I can explain it. So they are simply fluid-filled sacs which are found in the ovary. Now, normally these ovarian cysts are asymptomatic and they don't cause any problems. So let's go ahead and discuss what the cause of this ovarian cyst really is. So there have been found to be different causes of ovarian cysts. One of it is hormonal causes, and these hormonal causes actually are the kind of cause that we experience when a woman is taking some medications to induce ovulation. Medications like letrozole or clomid. So when you're taking these medications to induce ovulation, it can lead to ovarian cysts. Another cause is pregnancy. In the early stages of pregnancy, a woman usually develops a cyst. And this cyst, when it is developed, it helps to actually produce progesterone. So this progesterone actually helps to stabilize pregnancy. But in some situations, these cysts do not go away and it might need to be removed. Another cause is severe pelvic infections. So when someone has pelvic infections which are not properly treated, they can go ahead to spread down to the fallopian tubes and also into the ovaries, and then it can cause it can cause what we call ovarian cyst rather. So another cause is endometriosis. So women who have endometriosis can develop a kind of ovarian cyst known as endometrioma. So in this case, the endometriosis tissue attached to the ovary and they form a kind of growth. In this situation, it can cause pain during intercourse. So let's talk about the two main types of ovarian cysts. One is functional ovarian cysts and the other one is the pathological ovarian cysts. Let's talk about the functional ovarian cysts. The functional ovarian cyst is a normal kind of ovarian cyst. In fact, it occurs as a normal part of the menstrual cycle. It is nothing to worry about. It is very common and it doesn't have any symptoms. So it usually happens as part of the menstrual cycle, as I mentioned, when there is release of the follicle stimulating hormone and the luteinizing hormone, which eventually leads to ovulation. So it is nothing to worry about. But when we talk about the pathological, that is the pathological type of ovarian cysts, it is the one that occurs with symptoms and it is caused due to an underlying disease condition, something like endometriosis. You remember when I talked about endometriosis as one of the causes of ovarian cysts. So this is it coming under the pathological cause of ovarian cysts. So in this case, you will find out that it is caused by something. Now, talking about this pathological cause of ovarian cysts, it is worth noting to know that most ovarian cysts are not cancerous, but in some situations, some are cancerous. So most women who are post-menopause, women who have entered menopause, these are the women who are more likely to have cancerous ovarian cysts. Next is the symptoms. So what are the symptoms of ovarian cysts? So one major symptom is pelvic pain. Yes, this pain can be dull, it could be very severe and sharp, and is usually felt in the lower part of the abdomen and also on one side of the leg. Yes, that is pelvic pain. Another one is pain during intercourse. That's another symptom many women experience. Then we also talk about weight gain or weight loss. So when you experience these symptoms, actually, there are things that require intervention. Then another symptom is heavy bleeding or irregular periods. Then we also have the pressure symptoms. In pressure symptoms, I mean when this is exerting some kind of pressure on either the rectum or the bladder. Yeah. So in this case, you find out that the person usually finds himself going to the toilet to have a poo, and then on getting there, you're not able to pass any physics at all. Then another of the pressure symptom is that which is exerts on the bladder. So it makes one not to be able to hold a reasonable amount of urine, and this makes you to usually go to the toilet to pass any little amount of urine that you make. So that is the pressure symptoms. We also have bloating. In this situation, the person feels bloated, and when you eat just a little amount of food, you feel full so quickly. So these are the common symptoms which are noticed when someone has ovarian cysts. In some cases, one can have difficulty getting pregnant when someone has ovarian cysts. And then finally, but not the least, is nausea and vomiting. So in this situation, when the cyst usually twists, it can cause nausea and vomiting. And these symptoms usually require serious medical intervention. So, at the beginning of this video, I told us that it is very possible to get pregnant even with ovarian cysts. So let's find out. Getting pregnant with ovarian cysts is very possible. To begin, if you have ovarian cysts as a diagnosis, first of all, find out the cause. Knowing the cause is what determines the kind of treatment that you are gonna receive. Now, if your ovarian cyst is caused by pelvic infections, the best treatment is the use of antibiotics. If they are caused by bacteria, they will simply respond to the antibiotics and you will be fine. And then you can easily get pregnant. Next is if it is caused by other factors. So that is why it is very important that you have a good discussion with your medical practitioner. And then after all the investigations has been carried out, the appropriate treatment will be given and you will be good to go. So let's talk about the treatments. Let's also know that when we talk about the treatment, it is dependent on the size and appearance of the ovarian cysts, the symptoms you have, and whether or not you have been through menopause. So let's get started. The treatment is divided into medical and surgical. So regarding the medical aspect, it simply means the use of medications to treat ovarian cysts. So for the hormonal causes of ovarian cysts, we can use the hormones, the hormonal contraceptive, to treat them. So when we also talk about the other causes like caused by pelvic infections, you now treat them with antibiotics. Now, when we also talk about the surgical type of intervention, the surgical management simply means the use of surgery to remove these cysts. And this is dependent on what actually is making your medical practitioner go in for the surgery, because sometimes the cyst might be removed and your ovaries will be left intact, which is good. In some other situations, both the cyst and the ovary might be removed. Maybe one ovary might be removed or two of the ovaries might be removed, which means the person can no longer produce eggs and can no longer get pregnant. But what can lead to this? For instance, if the ovarian cyst is cancerous, in this case, it is very likely that you will be given that option of choosing the surgical removal of the ovaries. So that is another serious kind of treatment which has to be discussed with someone before it is carried out. So these are the major kinds of treatment that are available for people with ovarian cysts. So if you have not reached menopause, it is less likely that your ovarian cyst is going to be cancerous. So in this situation, you might just end up having to take some medications and you will be fine. So the most important thing is seeking for help. speak with your medical practitioner and you will definitely get help. Ovarian cysts is normally harmless. A vast majority of them are harmless. And if there is need for you to seek intervention, you are having this severe abdominal pain and you are having irregular periods, or you are having some of these pressure symptoms I mentioned, difficulty in having a poo and always having frequency in urination. When you begin to have these symptoms, it's very important that you seek help and it is properly treated on time, and then you can get pregnant. So this brings me to the end of this video. Do not forget to like, share, and subscribe to my channel, and give me a big thumbs up so that YouTube can recommend this video to more people out there who will benefit from it. Thank you for watching, and bye for now.